Okay, so I want to start out by addressing Eric's point. So he stated that, the argument was that the anabolic steroids would be forced, but, you could, for us, we're saying that it could be more of an optional thing. So, like Jennifer said as well, we know that due to the black market, a lot of these drugs are already being abused, and many of the side effects are actually, it's possible that we can manage them, such as, the increase in LDL, we can put them on a statin or something like that. So by knowing our patients that are abusing these, we can properly manage their side effects.
Okay, and then also for the study that was mentioned, where 56% of the deaths were attributed to sudden cardiac death. From the study, we don't really know how many of those firefighters already had a history of using steroids or had a history of using other substances that could have attributed to those deaths. And it was also only looking at 1 year, so we don't really know the whole scope of what actually is causing these deaths in all firefighters.
And the last point I would like to counter is the point about decreased death-related, fire-related deaths since 2002, where the opposing team stated that fire-related deaths decreased from 3,900 to around 3,000. And that's very good, and it's obviously a good idea to continue to educate the public and ensure that there's prevention programs. But those programs are fairly useless when it comes to a building being on fire and someone has to run in there and kick down a door to save a child. And if that were you or someone you cared about, you would want someone who is physically capable of doing that in order to save someone you care about's life.
Now it comes on.
So moving again back to arguments against, very quick comment about the positive effects of the use of steroids. Yes, these are all factors that can be increased, but to keep in mind is that these are all things that we are able to achieve through traditional methods as well. Granted, we might not be able to achieve the same level, but we really would have to look at is the difference in the increase that we would see versus traditional training versus steroids, is that worth all the side effects that we put the individual at risk to? In addition, that traditional type of training builds up a certain level of self-discipline in these individuals, which is something that we would find very important in individuals in this line of work or in police work or any of these public safety services. Moving on to the discussions that they brought up regarding the dosing or schedule that we could put them on for the use of steroids that would be appropriate for them. Part of the problem, like Cindy brought up earlier, was we still don't have any long-term data regarding the use of steroids in these types of situations, so we wouldn't be able to really determine what a safe schedule would be. On top of that, each individual would require a different dose of steroids to achieve their target. Now, on top of that, once we say that each individual would be able to get a different dosing, we can potentially open up a floodgate where an individual who wants just that little bit more juice to say, it's not quite working out, I want a little bit more. And there's a line, where is too much? And lastly, regarding the impact of improved fitness and stamina on the results of that training study that they discussed. While, of course, the more fit the individual is, the better the results are going to be, we also have to consider that how is that going to affect their long-term active time as a firefighter? So let's say that by using steroids, we increase their fitness by just an arbitrary number, 20%. Fantastic. But what if this means that their time of service is now 15 years instead of 25 years that we would see in someone who does not have steroids? We now are looking at a situation where we have individuals that are better, more efficient, but for a shorter time frame, and is that what we really want at this time?
Okay. So in regards to the point that Jennifer mentioned about prohibition, so the article actually drew a comparison between the prohibition that took place in the 1920s, which was the ban on alcohol, as we all know, which led to the rise of the largest black market in alcohol and Al Capone and gangsters and stuff like that. So they drew their comparison basically saying that outlawing things altogether was not a positive way to control like alcohol abuse and stuff like that and curb overall excessive alcohol consumption and drunken behavior in public. The difference between that and steroids, however, is that steroids at this time isn't a widely used like entertainment factor like alcohol. So something that is different is that at the time, alcohol and bars and stuff like that were commonplace, and they decided to outlaw something that was just very open to the public as is. However, steroids at this time is not something that people or the general public recreationally uses. So it's not the same in that concept, in the construct that we're not taking away something that we've already allowed people access to, they've already been exposed to, and possibly they have some sort of dependency on. We are preventing the dependency from developing. We don't want people exposed to that because the more exposure they have, the higher chances they have of being dependent and the higher chances they have of being at risk for those cardiovascular risks that we discussed earlier.
And lastly, as the opposition spoke about how steroids have been used for FDA-approved indications and how they have been shown to have benefit, although that might be true, as pharmacists, we've got to decide what is the best option for those indications. So anabolic steroids are usually used only when absolutely necessary and are often second line to preferred agents. An example of this are erythropoietin-stimulating agents that have replaced steroids as the drug of choice for bone marrow stimulation for certain anemias, and how synthetic growth hormones have replaced steroids to treat growth failure in pediatric populations. The reason for this phase-out is very simple. Steroids have just too many negative health side effects to warrant their use, and therefore other agents are taking their spot. Furthermore, there's not really an indication for the use of anabolic steroids for simply the use of increasing functional strength. Use of testosterone in conditions like hypogonadism is aimed at increasing spermatogenesis and testosterone levels in our blood, not necessarily for increasing muscular strength. So I feel like this increasing strength indication is just something that's very ridiculous and very irresponsible for us to approve at this time.
Well, thank you very much. Let's thank all of our panelists.